Hi, I'm Dr. Moore. In today's video, we're going to talk about the way we take care of people with neuropathy. And we have 4 treatment goals. The first goal is to restore and improve the blood flow to the area. This is in turn going to get more oxygen and more nutrients to the nerves so the nerves can start to heal and regenerate. And we do this by using something called infrared diode technology. This is low light laser therapy. This was actually developed by NASA. Now NASA developed this because if you were on the space shuttle and you cut your hand, it took an abnormally longer period of time for that wound to heal. So they needed something to boost that up. And so when they discovered infrared diode technology, they used that. When they brought it out into the public, they used it for diabetic wound healing. And then it became known how the mechanism worked, and we use it for peripheral neuropathy. And how it works is it stimulates something called nitric oxide production by the cells. Now, nitric oxide, the guy won a Nobel Prize in 1998, so that means this information is relatively new. Some people will say, hey, Dr. Moore, why doesn't my other doctor know about this? Because this is new stuff, and might not be familiar with it at all. But how nitric oxide works is it causes vasodilation. The blood vessels in the area open up so more blood flow can come in. And then it stimulates something called angiogenesis. And this is actually the regeneration and rebuilding of lost blood vessels. So you get more blood vessels. And another way that we stimulate more blood flow to the area is through vibration therapy. Now vibration therapy at 30 to 50 hertz stimulates blood flow to the area. You may have a foot massager at home, or you might have tried vibration in another area. And if it didn't have the right hertz range, it's not going to work. And so we've got more oxygen to the nerves, we've got more nutrients to the nerves. That's the idea of getting more blood flow to the area. Then we've got to get the inflammation going. We've got to do some nutritional deflaming. We've got to teach you what you can do at home to get rid of the inflammation, because inflammation equals pain. And some of you may have been to the doctors for pain and they gave you an anti-inflammatory. Now the anti-inflammatory helped reduce the pain, but it didn't get rid of the reason you have the inflammation. So we've got to teach you how you get inflammation and get rid of that, especially in a diabetic, because inflammation equals poorly controlled glucose. And inflammation and high levels of insulin in a type 2 diabetic cause arterial stickiness. Normally cholesterol kind of floats through the arteries, but with high levels of insulin and inflammation, it becomes sticky, and that's what destroys the arteries. That's what destroys the blood vessels in a diabetic. So if we get rid of the inflammation, we can help with that also. And then we have to stimulate small fiber nerve growth. Now here's some great information from the National Institute of Health. It says peripheral nerves have the ability to regenerate axons as long as the nerve cell itself has not died, and this will lead to functional recovery over time. So what this means is that your nerves can heal. When I was in school in the early 90s, they told me, no, your nerves can't heal. That's how you damage the brain, you damage the nerves, have a nice day. But now we know, and the National Institute of Health will tell you, that nerves do have the ability to regenerate as long as the nerve has not died. And if they do regenerate, that's going to improve your function. So if you've been to your doctor and he said, you can't help people with peripheral neuropathy, it can't be reversed, the National Institute of Health says otherwise. And how do we stimulate small fiber nerve growth? We'll use something called pulsed electromagnetic frequency. What we found in our office is that people come in with a chronic disease or dysfunction, their cells have lost energy. So they don't have a lot of energy to heal. They're way down on the energy spectrum. They should be up here, that the cell has this much energy. So pulsed electromagnetic frequency simply recharges the energy in the cell, and if a cell has energy, a cell can regenerate. But if a cell drops to a certain level, it no longer has the ability to regenerate. So we've got to boost the cells up so they can regenerate and they can heal. It's just simply a matter of recharging your cellular batteries. And Dr. Oz said, magnetic therapy uses the power of magnetic energy to redirect electrical impulses to the areas where you feel pain so relief and healing can begin. And the last thing we want to do is decrease your brain-based pain, because I'm sure you want to feel better. And we've got to reset the way the brain and the body communicate. And one way we do this is we use something called a rebuilder. Now the rebuilder, you can see the person has electrical conductive socks on there. The rebuilder resets the gap between the nerves, because as the nerves break down, a very large gap forms, and more than normal in the synapse. So we've got to reset that gap, and that's how I think the rebuilder works best, to reset the gap along the neurological pathway, all the way from the bottom of your hands, your feet, all the way up to your brain. So it's a great way to stimulate healing in the nervous system all the way through the neurological pathway. And then what's interesting about that is the Cancer Treatment Centers of America, this is their #1 tool that they use for chemotherapy-induced neuropathy. Then we use something called Trigenics and functional neurology. Trigenics is a non-surgical neurological procedure that resets the way the brain and the body communicate. What this does is it instantly gives you better range of motion, you move better. It decreases your pain so you feel better, and it restores neurological tone through the whole body so the nervous system starts to function better. And because this is a brain-based procedure, it has a global effect. Your digestion improves, your breathing improves, your heart, your lungs, your liver, your outlook, your demeanor improves. You're just more comfortable, you sleep better, and you feel better. And then we do functional neurology. And the idea of functional neurology is to help rehabilitate the nervous system. As I might have mentioned before, is in the early 90s, they told us that your brain doesn't heal. Well, in functional neurology, through a system called neuroplasticity, we have found out that the nervous system does in fact want to heal and does heal. It's quite capable. It just has to be stimulated and given the opportunity. And that's what we do as a functional neurologist. Now, some of you may have been to your neurologist before. Neurologists are great. They're going to help you if you've had a stroke, a tumor, a disease, and it's life-threatening. They're going to come in like a firefighter, and they're going to come with an axe. They're going to bang the door down, and they're going to get that hose, and they're going to squirt everything down and put that fire out and save your life. And that's great. But when your house is no longer on fire and it's time to rebuild your body and heal, you don't want to use an axe, and you don't really want to use a fire hose anymore either. You want to get a carpenter, and that's why I love Tim the Tool Time Taylor in this video, is because we're going to be the carpenter. A functional neurologist uses neuroplasticity, and we're the carpenters that help rehabilitate the nervous system, because your nervous system can heal. So we've got more oxygen and nutrients to the nerves by improving the blood flow. We've got rid of inflammation so that irritation is gone. We've also stimulated small fiber nerve growth with the pulsed electromagnetic frequency. And we've decreased the brain-based pain. So we've got that's our 4-step procedure in helping you get a lot better and get results that you're looking for without drugs, without surgery, getting your life back and living the way you want to live. I'm Dr. Moore, and I welcome your phone calls. And if you'd like to call us and make an appointment in our office, you can call today, 810-225-7246. That's 810-225-7246. We'll do our best to help you. Have a very awesome day.